Focus on the impact of COVID-19 on education. Loss of study time, no money to buy food or personal items. These are among key findings of a study on the impact of COVID-19 on higher education students. Those at technical and vocational colleges bore the brunt of the lockdown's impact on higher education. A study by Higher Health, which is the department's student wellbeing unit, has revealed they didn't have adequate access to the resources required for online learning. Lindsay Dentlinger reports.
40% of tertiary students had to leave campuses at the start of the lockdown and head home. But for many, it meant an inadequate environment to continue their studies.
I am concerned about the impact of COVID-19 on first-year students, because they are the ones who need to be on campus most. They are the ones who need to adjust from school to university.
While over 80% of university students received the necessary support to continue their studies online, less than 40% of vocational students were even offered the option of virtual learning.
We are, for instance, dedicating a bit more resources to those institutions that in the past were serving black communities, which we call historically disadvantaged institutions. We are doing additional resources. We are even focusing on infrastructure. Our infrastructure is more biased towards them so that they actually have better facilities, including ICT infrastructure.
Higher Health says the impact of COVID-19 on students, many of whom have lost parents or grandparents, has been largely neglected.
It's predominantly clear that the variants are showing high affinity to young people. Last month we lost a student in TUT. A brutal reminder that COVID and complications do happen on young people, and there are fatalities among young people too. We are a vulnerable society as higher education at times. We are a congregate setting. We have young people together in classrooms.
The Cape Peninsula University of Technology is one of only 3 campuses in South Africa to open its own vaccination site. Nzimande says all institutions who can afford to should establish vaccination sites, particularly in rural areas, to help ramp up vaccination. Lindsay Dentlinger, Cape Town.